This is Katie Gibson and Erica Towery presenting on Camp Nursing, the potential effects on a nurse's level of compassion fatigue and resiliency. So our problem statement starts out with healthcare organizations putting significant efforts towards investments to improve coping skills of their nursing staff while reducing burnout and improving the quality of care. Unfortunately, continual research on nurse satisfaction indicates that burnout, high nursing workload, and stressful work environments are continuing to lead to the declination of work performance. Compassion fatigue experienced by nursing staff can affect the quality of care that is provided to patients and families as well as individuals' emotional well-being. Compassion fatigue increases the risk of long-term health issues, including anxiety and depression. It's also been linked to providing inadequate care and exhibiting feelings of indifference towards patients, increasing the potential for critical mistakes, medication errors, and decreased patient satisfaction. Our organizational leaders must remain aware of the need for resilience and healthy coping mechanisms to combat negative emotional states, including compassion fatigue, job satisfaction, retention-related issues, and improve the care provided to patients and families. The purpose of this study is to evaluate the relationship of compassion fatigue and resilience in nurses who attend camps for children with serious illness and/or disabilities. Our specific aim number 1 would be, does nurse participation at these summer camps prevent or impact the concept of compassion fatigue? Our hypothesis is that we hypothesize there will be a decrease of compassion fatigue in nurses who attend camps. Specific aim number 2 would be, do the nurses' experiences of volunteering at medically complex summer camps improve nurse resilience after returning back to the high-stress hospital environment? We would hypothesize that there would be an increase in resilience to those nurses who attend camps.
If we are able to show that camp nursing has an impact on compassion fatigue and resilience, organizations will be able to recognize the significant benefits that camp nursing can bring to their healthcare teams. Clinical leaders should utilize this camp experience as a tool to help nurses who are at risk for or who are experiencing emotional distress related to nursing. Maintaining the cognitive well-being of our bedside nurses can improve retention rates. If we are able to show that camp nursing has an impact on compassion fatigue and resilience, organizations will be able to recognize the significant benefits that camp nursing can bring to their healthcare teams. Clinical leaders could utilize the camp experience as a tool to help nurses who are at risk for or who are experiencing emotional distress related to nursing. Maintaining the cognitive well-being of our bedside nurses can improve retention rates and nurse engagement within an organization, as well as improve the quality of care delivered to our patients and families. The theory we selected for this study is Watson's theory of human caring science. This theory suggests the idea that one's own practice can achieve wholeness of the mind, body, and spirit. Compassionate care is one key component of this theory, and it is defined as a way of becoming and belonging together with another person. The setting of camp provides nurses with an opportunity to be in relationship with their patients as campers in a setting that not only requires nursing care. The opportunity to do for one another while also being with one another is at the core of transpersonal caring relationships. This describes the relationship between the camp nurse and their camper. Camp also offers nurses the opportunity to be authentically present with campers. In this setting, outside of the hospital, nurses are able to create memories and participate in experiences that promote relationship and require authentic presence. These opportunities support the dynamics of compassionate care and transpersonal caring relationship. Our variables for this study are compassion fatigue, resiliency, and camp nursing. The literature speaks to pediatric nurses being at risk for developing compassion fatigue. Compassion fatigue is described as a lowered state of physical, mental, and spiritual well-being related to caring for sick patients. Detrimental side effects of compassion fatigue include burnout, increased turnover, a decreased desire to care for others, and physical, emotional, and spiritual exhaustion. Because pediatric nurses are often involved in caring for children with acute illness, trauma, or at end-of-life care, they are exposed to many stressful situations. When compassion fatigue is studied, it is often linked with compassion satisfaction, which is a concept that internally encourages healthcare providers to continue to use their skills and compassion to provide care for patients. Researchers evaluate levels of compassion satisfaction along with the components of compassion fatigue, which are burnout and secondary traumatic stress. The Professional Quality of Life Scale, otherwise known as the ProQual scale, has been used to measure compassion satisfaction and compassion fatigue in several studies. The ProQual scale assesses burnout and secondary traumatic stress, giving researchers a level of compassion fatigue for that healthcare provider surveyed. Studies have been done on several different groups of nurses using the ProQual scale, offering the idea of the prevalence of compassion fatigue throughout different specialties. Benefits of a lowered compassion fatigue include increased compassion satisfaction and increased engagement. Nurses who are able to recover from adversity and react appropriately to a distressing situation are thought to have resilience. Resiliency is defined as possessing the ability to use coping strategies to decrease distress. Resiliency in nurses is thought to be a key contributor to preventing negative emotional states in nursing. Several studies have looked at resiliency in nurses using the Connor-Davidson Resiliency Scale. This scale has been showcased as an effective tool in measuring resilience as a variable in nursing. Benefits to increased resiliency include lower levels of burnout and decreased emotional distress. Camp nursing is our final variable. Camp nurses have been described as help for medically complex camps, non-medical summer camps, day camps, and overnight camps. The setting and type of camp may vary, but the role of a camp nurse remains constant. They provide medications, first aid, and emergency care to campers. And at camps for medically fragile children, they also monitor campers who have chronic illness and provide education for campers. Several studies look at how camp impacts campers, and we were able to also find studies that looked at the relationship between camp and volunteers. The research around the impact of camp on camp nurses was very minimal. We were able to find studies that discussed the experience of camp nursing and perceived confidence following student nurses' camp experiences. Because there was no research found looking at the relationship of camp nursing and nurses' well-being, we looked at this as an opportunity to explore the relationship between camp nursing, compassion fatigue, and resilience.
It can be assumed that camp would have a positive impact on nurses, potentially affecting compassion fatigue and resilience. Some potential limitations that we identified were a low sample size possibility, as well as a small geographic area of data collection, despite the wide variety of camp nurse experiences across the nation. This will be an experimental study with a non-randomized controlled trial. The setting and sample include nurses who attend Children's Healthcare of Atlanta sponsored camps for children with serious illness and/or disabilities. Our participant goal will be 80 nurses. Inclusion criteria include all nurses with no exclusion to age, race, and years of service or location of nursing practice who attend camps for children with serious illness and/or disabilities sponsored by Children's Healthcare of Atlanta. Exclusion criteria include nurses who did not attend camps for children with serious illness and/or disabilities sponsored by CHOA. Nurses who attend camps for children with serious illness and/or disabilities sponsored by Children's Healthcare of Atlanta will complete a Professional Quality of Scale ProQual study tool as well as the Connor-Davidson Resiliency Scale in the form of a survey to evaluate the relationship of compassion fatigue and resilience in those who attend. The nurses who consent to participate in the study will complete the survey prior to attending camp. They will also complete the survey within 2 weeks following camp and again at 3 months after camp. We aim to evaluate the relationship of compassion fatigue and resilience in the months following the camp experience. Our data management and analysis plan will be to provide an online consent with the option to opt out. Identification numbers will be assigned to the initial surveys to allow us to connect to future studies while ensuring confidentiality. Data will be stored on a password-protected platform and not downloaded onto any external devices. Nurse researchers, CHOA statistician, and KSU faculty chairperson will be the only individuals with access to these results. Data will be destroyed upon expiration of this project. Some statistical considerations that will be used to analyze the data will be to use descriptive statistics such as means and standard deviations, medians and ranges, or counts and percentages. We are striving to look at changes in the professional quality scale as well as the Connor-Davidson resiliency scale scores, and we'll be analyzing it using a paired t-test with a 0.05 significance level. Data will be tabulated at each time point of interest, including pre-camp, post-camp, and 3-month follow-up. Nurse researchers will partner with our CHOA statistician to complete the post-hoc pairwise comparisons for the 3 time points. Our overall goal through this study process is to measure the baseline compassion fatigue and resiliency data for each nurse attending camp, with the hope of seeing a decrease in compassion fatigue and an increase in resiliency following the camp experience. The final data collection will look for sustained benefits, hopefully showing unchanged levels of compassion fatigue and resiliency. Sharing our study results regarding the benefits of camp participation could allow more organizational support and approval of this process and allow more nurses in the future the chance to step away from the bedside and care for their patients in a different environment, allowing patient-nurse connection and personal growth and well-being for all involved.